Forward head posture in the digital age. As a student of osteopathic medicine in the late 1990s and soon after qualifying as a registered osteopath, the most common presenting problem in the clinic in those days was lower back pain, which was much more common in manual workers whose days mainly consisted of bending, lifting and carrying. However, over time, more and more sedentary workers have needed osteopathic care, usually presenting with neck and upper back issues. The reason for this has been twofold. One is that the technological revolution has resulted in more of the workforce being seated for much longer hours than before. And secondly, the advent of tablets and smartphones have created new ergonomic issues that we are still struggling to deal with effectively. Long-term chronic use of these devices can cause a phenomenon called forward head posture, FHP. FHP, also known as text neck, scholar's neck, reader's neck and poke neck, is a very common condition and is described when the head, specifically the ear area, sits forward in relation to the shoulder joint. In the ideal posture, our head should sit directly on top of our neck and in line with our shoulders with minimal muscular activity, balancing your head. Sometimes this is described as a golf ball on a tee. An interesting fact to note is that for every 2 centimeters your head protrudes forward from this ideal alignment, you add approximately 5 kilograms of force onto your neck. That is a lot of potential pressure on joints, soft tissues of the neck and back, which can cause a huge variety of issues from headaches, arm pain, neck pain, shoulder issues, back pain, to even jaw problems. What are the causes of FHP? In modern societies, FHP is at pandemic levels. Sedentary work, staring at screens, particularly tablets, laptops and phones, which force us to look down while typing and browsing, are squarely to blame. Sitting and driving for long periods, especially if you round your shoulders and spine, can also contribute to FHP. If this continues for long periods, certain muscles become shortened and tight, and some become stretched, thus compromising the integrity of the ideal posture and putting the spinal elements under undue stress and making the whole area work inefficiently. These postural imbalances result in long-term issues from muscle strains or pain, myalgia, disc herniations and bulges, arthritic wear and tear changes, which carry the potential of irritating the delicate nerves of the spine, causing further pain, weakness, and pins and needles into the arm and hand. So what can you do to address these postural imbalances? Manual therapy is a very effective tool to help address such imbalances. So my first piece of advice is to get seen by a qualified healthcare practitioner who specializes in pain and injuries. That may be a physiotherapist or an osteopath, but other experienced manual therapists may be able to guide you through this process as well. In these scenarios, one has to bear in mind that the body will respond to its primary stimulus. So if you are spending endless hours staring at your phone, there will be a limit on what a short session of manual therapy can do to reverse that. So you will need to be consistent with your exercises and postural adjustments to minimize the effects of FHP, thus maximizing the effects of good manual therapy. Here are a few exercises which may help in cases of forward head posture. Suboccipital release. The suboccipitals are a small group of muscles at the base of your skull, connecting it to the upper vertebra of the neck. These can get particularly tight in cases of FHP, but you can gently release these using a massage or tennis ball. Lay on your back or lean up against the wall with a ball under the base of your skull. Roll gently up and down and sideways to work into the tender points, approximately 20 to 30 seconds at a time. Work this mindfully. It should not be more than 2 or 3 out of 10 for discomfort. Sternocleidomastoid release. The sternocleidomastoid is an important muscle in the front of the neck which can get very tight and therefore pull our head into forward head posture. You can release this by locating the band of muscle which sits on either side of your throat and gently pinch it for about 20 to 40 seconds to relax the muscle. Again, do not push through any pain. You should only experience a mild discomfort. Chin tucks. These effectively reverse the poor form of forward head posture by activating the lengthened muscles and stretching the tightened muscles, which cause the FHP phenomenon. You can sit upright and gently draw and tuck your chin back while elongating the back of your neck. Imagine someone is lifting you up by the hair of the crown of your head. Hold for 5 to 10 seconds and repeat 20 times. Always avoid pain when doing these exercises. Just touch on the mild discomfort of a stretch and never work through the pain. You can also do chin tucks while laying on your front. This adds gravity to the muscular activity and helps develop strength in the required muscles. Hold the chin tuck while laying on your stomach for 5 to 10 seconds and repeat up to 20 times. The cervical sit-up. Stabilizing the neck requires activity of the muscles at the front of the neck, which are prone to becoming weak in FHP. Try laying on your back with your head in as neutral a position as is comfortable. Do a gentle chin tuck as described above, but then slowly lift your head off the floor or pillow by sending your chin towards your chest and bring back down with control while maintaining the chin tuck. Do 15 to 20 repetitions of this cervical sit-up. Repeat up to 3 times per day. You will feel the muscular activity towards the ends of each set of these exercises. The doorway stretch. Poor mobility of the rib cage, chest and mid-back can also contribute significantly to FHP and any accompanying neck pain. Foam rollers are excellent tools to mobilize these elements of the thorax, but you can get a great stretch of the chest by placing your forearms vertically on either side of a door frame and gently pushing the chest through to stretch the front of your thorax and chest. Again, hold for 20 to 30 seconds and repeat 3 times. Never work through any painful movements. Postural advice. Computer and tablet work is a huge culprit of FHP, so it is essential to ensure that your workstation is set up optimally. If you work on a desktop device, ensure that the top third of the screen is at eye level, so your head can sit on top of your neck and look straight ahead. If, however, you have to work on a laptop, it is recommended to purchase a stand and a separate keyboard so you can place the top third of the screen at eye level and the keyboard can be at elbow level. Only be sitting at your workstation if you really need to be sitting. For example, stand up to take a call or to read a document. These mini and micro breaks will give those tight muscles a much needed break and will reduce the long-term muscle tightening seen in FHP. Bedtime is for sleep. One strict rule I have for all of my patients is that they should never bring a phone, tablet, nor laptop into bed with them. Maintaining ideal posture when using such devices in a seated or even a standing position is difficult enough, but that is impossible in bed. Yes, even if you are sitting up in bed or laying on your side, there is no way to work around this. Leave your bed for sleeping only. Pillow advice is very specific to the individual. Be aware that too much pillow padding when on your back can also bring your head into forward head posture. Try to sleep in as neutral a neck position as possible. A decent supportive pillow while sleeping on your side in neutral is my suggestion if at all possible. If you are in the London area and you would like to book in for an osteopathic consultation at Mayfair Osteopathy, please contact us on info@mayfairosteopathy.com.